how do you know if you are infected with COVID-19? In the early stage of the outbreak, organization experts such as WHO said symptoms may include fever, cough, shortness of breath, breathing difficulties, headaches, and chest pain. But as the virus progressed, medical staff found out that there were confirmed cases that didn't have any respiratory symptoms, but rather gastrointestinal symptoms such as vomiting and diarrhea. And just recently, scientists have discovered that the virus exists in excrement as well. If you have any of the symptoms I mentioned before, you should go to the hospital and get yourself checked for the coronavirus immediately.
The majority of COVID-19 cases are mild. Some even have no symptoms. If you do have symptoms, they could show up 2 to 14 days after exposure. They're most likely to be similar to a regular cold, the flu, or seasonal allergies, like a fever, headache, fatigue, sore throat, and runny nose. Coughing and shortness of breath are common, according to the Centers for Disease Control and Prevention. The older you are, the more likely you are to experience severe forms of these symptoms. Some cases have gastrointestinal symptoms, such as diarrhea. In more extreme cases, and for people with underlying health conditions like heart disease or diabetes, you can develop pneumonia, frequent or high fever, persistent cough, and signs of respiratory distress, like shortness of breath and chest pain. A small percentage of cases progress to acute respiratory distress, difficulty breathing, chest pain, and pressure. Confusion, extreme fatigue, persistent pain, or other severe symptoms require immediate medical attention. The result could mean shock, organ dysfunction, or heart failure. If you have severe symptoms, it's definitely time to get in touch with a healthcare provider. But with milder symptoms, it's a good idea to call your primary care doctor first, instead of rushing to the emergency room.
It starts with a fever followed by a dry cough. It can then lead to a shortness of breath, and some patients require hospital treatment. Other symptoms are headaches, tiredness, nasal congestion, sore throats, diarrhea, and muscle aches. Symptoms often show as mild and begin gradually. If you're in a high-risk group with existing medical conditions, or the elderly, or if the person develops a fever, cough, and breathing difficulties, you should seek medical attention by phoning the medical services rather than going to hospitals or medical centres.